Hello everyone, I am Sandra May Ibanyola from BSN 212E of Davao Doctors College. And today I am going to perform the Leopold's maneuver. So this procedure I'm going to do is to determine the number of the fetus in the womb, to know the expected position, presentation, degree of descent, and of course the attitude of the fetus. It is also to determine or to identify the point of maximum intensity of the fetal heart tone in relation to the mother's womb. So prior to the conduct of the procedure, I have prepared the necessary equipments needed, which includes the pillow, a towel, and a stethoscope. And of course, before doing the procedure, we need to wash our hands in order to deter the spread of microorganisms as well as to protect myself and my patient. Hello ma'am, good morning po. I am Sandra May Ibanyola, your student nurse for today. Can you please state your complete name? Your birthday and civil status, please. Okay, thank you very much, ma'am. But before that, may I ask what should I call you? Okay, thank you very much, ma'am Dayan. So I am going to explain the procedure to the language that the patient understand. Okay, so ma'am Dayan, ang gagawin ko natin is hahanapin natin kung sa parte bang ito ang ulo or ang puwet ng baby nyo. And hahanapin din natin kung saan banda yung likod ng baby nyo, kung dito ba or dito. And hahanapin din natin kung anong unang parte ng katawan ng baby nyo ang lalabas dito. Kung ang paa or ang ulo po ba. So pag nagpapalpate po ako sa tiyan nyo, maglalagay po ako ng pressure. Pero huwag po kayong mag-alala dahil safe po ito sa mga buntis na kagaya nyo and hindi po ito nakakasama kay baby po. Okay lang po ba? Okay, thank you very much, ma'am. So, I have already closed the door so that no one from the outside could be able to disturb you while we are doing this procedure. But before that, ma'am, I highly encourage you to void first so that you won't feel uncomfortable during this procedure. Okay, ma'am, so you may now go. A distended bladder may slightly elevate the uterus. Okay, ma'am, so you're now back and done voiding, so I need you to lay down. And slightly flex your knees. This is to facilitate accurate assessment and as well as to provide comfort to the patient. And by flexing the knees, will relieve the tension in the abdominal musculature. So, okay ma'am Dayan, I need you to turn to your left side a little so that I can place this towel underneath your hip. Will that be okay with you? Okay. Okay, turn please. This is to shift the uterus away from the blood vessels, thus prevent supine hypotensive syndrome. So if you're right-handed, stand at the patient's right side or by directly facing the patient. And so this is to easily grasp the symphysis pubis to be done in the third maneuver. So to begin with the procedure, I am going to expose only the examination part, which is the abdomen or the womb. Okay, so now I am going to proceed with the first maneuver, which is called the fundal grip. This is to determine whether the fetal head or fetal breech is in the fundus of the mother. So now what I'm going to do is to palpate the fundus of the mother to determine which part of the body lies at the upper part of the uterus. So remember that if it feels round, hard, freely movable, it's called the fetal head. So if it feels soft and nudular, then it's called the fetal breech. Okay, so we're doing it gently. Okay, so it's soft and nodular. So now I'm going to proceed to the second maneuver, which is called the umbilical grip. This is to determine this is to determine the position of the fetal back of the baby. So what I'm going to do is to palpate my hands downwards in the lateral uterine fundus and apply pressure so that we can determine the fetal back. We can also place this one hand at a steady rate and let this other hand explore the other side. So remember, if it feels a long, continuous structure, then it's called the fetal back. Okay? So the other side. Okay, so here is the fetal back. Okay. So now we're going to proceed to the third maneuver, which is called the Paulick's grip. This is to determine whether the engagement has occurred, and by placing my thumb and fingers in the symphysis pubis. So remember to do it gently but correctly. Grasp. You need to grasp. We need to confirm if it's the head. Alright, now so we're done, or we're down to the last maneuver, which is the pelvic grip. This is to determine whether to confirm the third maneuver and to determine the flexion of the vertex in the pelvis. So now what I'm going to do is to face the patient like this and put my both hands and let my fingers to palpate downwards, starting from the abdomen to the symphysis pubis. Palpate for the cephalic prominence or the vertex position. So prominence as the same back, small part suggests the head is flexed. Prominence at the same side as the back suggests the head is flexed. Okay. So now, we're going to locate again the fetal back and listen for the fetal heart tone in 1 full minute. So it's here, by using the bell side of the stethoscope. Okay, so remember that the normal fetal heart tone starts at 120 to 160 beats per minute. Okay, so the fetal heart tone is at 135 beats per minute. So remember to note the location, the tone, and the characteristics of the fetal or the fetus. So make the patient comfortable. Don't forget that. And explain the result later. Okay, ma'am. So are you comfortable? Okay. Thank you, ma'am. Okay, so I'm going to discuss the result of the test to the language that the patient understand. Okay, so ma'am Dayan, so we'll start with the first maneuver, yung followed ko na yung ginanito ko yung parte nito. So dito po is nakalagay yung buttocks or puwet ng baby nyo. Nakaganon siya. And then, andito po nakalocate yung likod ng baby nyo. So bale, naka-face yung baby nyo sa likod nyo. So ganito. And then yung ulo niya is nandito na. So it is the normal position of the baby. So it means na good position po siya in terms of labor and delivery dahil fully flex po yung baby nyo. So pag ibig sabihin vertex position po, which is naka-flex yung baby, nakaganito, yung chin niya and chest is nakadikit. Then ganito is nakaganyan, nakataas yung paa niya, nakaganyan. So, bali, yung parang nakauklog, ganun yung nakauklog yung position ng baby nyo. So, it's nothing to worry about, especially the fetal heart rate po, which is within the normal limits, which is 135/160 beats per minute. So, since malapit na po kayong mga anak, I advise po to continue doing exercises, yung walking, so, para maiwasan yung pagmamanas ng mga binti natin. And of course, pagpatuloy na kumain ng mga masustansyang pagkain, yung mga prutas, avoiding tayo sa mga sweets masyado ma'am ha, para hindi po tayo magka-complication. And then, I advise you to continue visit your OB since malapit na kayong mga anak po. So that will be all with our procedures. So thank you for your cooperation and may God bless your journey. Thank you ma'am.